And we're back. Welcome back to Open Your Eyes. And we're moving now into our first segment for the morning. And this one will be, the conversation will surround a result from the 2019-2020 baseline study report on violence against women and girls in Belize. This is a very important conversation as to where we stand as a country and how we deal with, of course, women and girls. Now, Malenie Barnes, she's in with us. She is from the Spotlight Initiative Program. She's a Spotlight Initiative Program Officer for UNICEF. And also Cynthia Williams, who is the Executive Director for National Women's Commission. Good morning to both of you, and welcome.
Good morning.
Good morning, thank you.
I must say you guys are looking lovely this morning. Once again, welcome as we get things started. Now, I primarily would like to know about the baseline study. What does it entail? Why did it even come up? What is it about?
Okay, I'll start. So the baseline study came up as a result of the Spotlight Initiative that started in 2019. And we wanted to really get a sense of what the data looked like for violence against women and girls, particularly in the home setting. And this data did not exist. So as part of ensuring that our interventions were targeting the right gaps, we had to do this baseline study.
And before we get into some of the results and figures, can you share with our viewers a little bit about the Spotlight initiative and what it hopes to achieve?
Okay, so the Spotlight Initiative is a global initiative that is a partnership between the European Union and the UN, the United Nations. And it looks at addressing and eliminating violence against women and girls. In the different regions of the world, they're focusing on different priorities that affect women and girls. For Belize and the Caribbean, the focus is on family violence. And the intervention hopes to strengthen across 6 key areas, looking at legislation, institutional strengthening for service providers, including state and non-state, improving the prevention mechanisms, ensuring that we have quality essential services that can be delivered to women and girls at the community level, especially those that are marginalized and have limited access. And then how we collect and manage data, and finally strengthening civil society and women's movement to ensure that there is continuum for the interventions that are started through the Spotlight Initiative. So since the beginning of 2020, even in the face of the COVID pandemic, agencies, the 3 agencies that are implementing partners, UNICEF, UNDP, and UNFPA, engage civil society and government partners to roll out critical interventions to support those 6 key principles or pillars of the Spotlight Initiative. And so the baseline study data now, in a way, kind of acts as a validation for some of the interventions that we've started, as provide some additional information on what gaps exist across those 6 areas and how we can strengthen our interventions, as well as looking at how we can expand on what we've started.
We definitely would want to go to discussing the findings, what were found in these studies. But at the same time, how did you manage to garner data for this study?
So the study was conducted across 3 methodologies. The first looked at a knowledge, attitude, behavior, and practice survey that engaged 1,254 persons across Belize. And because of the pandemic at the time, we had to definitely change the modality. And so these surveys were done via phone, which of course created some ethical limitations on the types of questions or how deep we can ask certain questions to ensure that we were not putting anyone at harm. The second method was key informant interviews, and these included a total of 48 persons who represent government as well as civil society actors. And finally, we collected data that was documents, policies, manuals that existed, as well as were provided through the key informant interviews, and we did an assessment of those to look at where we are at in terms of the legislative framework, as well as the institutional capacities across the board of both state and non-state actors.
And perhaps this is a good time to get Cynthia into the conversation. You can, Cynthia, can you please tell us a little bit about the National Women's Commission's role in getting the results of the study, and also why it was important for the Commission to participate?
Thank you, Gavin. Certainly. The National Women's Commission as a national coordinating entity really plays a role in terms of strengthening the data mechanisms, data collection processes, because we recognize that continues to be an area of challenge for Belize. And like Malenie mentioned, the fact that the baseline was able to produce some baseline data points that we have known about it for years, but the actual evidence has not been possible to be created. And so the baseline really provided that space for us to be able to, excuse me, to have that. At the same time, the coordinating mechanism of the National Women's Commission allows for more partners to be involved and to be able to then provide input into the process. Like Malenie said, the fact that some of the partners who were were interviewed, some of the partners provided data in terms of documents, reports that they would have produced in the past. And the benefit of it is also the fact that the Spotlight Initiative builds on other issues that other work that have been done to other projects, such as the BA1 and also the UN Trust Fund project that was implemented years past. So really and truly, the National Women's Commission tried to really bring those synergies together, and also being part of the steering committee, it ensured that we kind of brought the focus of current national policy documents, such as the National Gender-Based Violence Plan of Action, and of course, what are the linkages to the national gender policy. So it's really and truly something that it's an initiative that we really promote the collaboration, the partnership, the intersectoral response to the issue, because that's the only way that we'll be able to really advance. So in this particular area, the aspect of gathering data and ensuring that data comes directly from the communities, from beneficiaries and other stakeholders, as well as those who are implementing projects and programs, is really critical, because then the response to it has to come from multiple levels, not only from one. It has to come with the individuals, it has to include communities, at the same time organizations and the policy level. So the evidence that is being gathered through the baseline data will then support some of the recommendations that is the responsibility, or where the National Women's Commission comes into play in terms of gender issues, particularly gender-based violence.
So let's now talk about the key findings. So, you know, one of the things, because Cynthia, you've been on the show many times when we spoke about gender-based violence and what to look out for, and we'll definitely dive into that as well. But the key findings, especially during this pandemic, where you know, people were at home, didn't know how to cope, with work environment. What's it like being at home all these hours with spouses, you know, children? We know that it was tough. Let's talk about the key findings of this study.
Right. I think for us, when we look at some of the findings, one of the things that, you know, kind of really is telling us that we need to be able to redesign the way that things are done is the fact that 90.2% of the respondents were unaware of any community activity that looks at the issues of gender equality, and the fact of, you know, the rights of women on sexual and reproductive health. While this baseline study looks at a particular time period, which is 2019-2020, I think it can help us to inform ourselves of the fact that we have been doing so much work, but yet not a lot of people in the communities, in their homes, are still very much aware of these particular activities. It also helps us to put numbers in terms of the reality that there are people, there are respondents who do continue to believe, they agree that men are justified in beating their partners, and individuals in the rural areas are likely more to agree. While the number is 11.2%, it does create a concern, because then, and in a way, it explains why the resistance in so many of these spaces to try and change the way that things are done, or the way that reports might be coming in, because people do believe that men do have a right to beat their partners. So those are particular two areas, I think, for us that kind of validated the fact that men have that perception, and of course women as well, and the fact that we still have to do so much work to ensure that people in communities, in households, are aware of what are the community activities that exist to protect, to support their well-being.
Malenie, I went over the numbers, and I actually was appalled of what some of the findings. But before I make mention of that, let's talk about the case study and where did it center, or was it centered most? Was it across the country? Was it specifically in the villages? Was it specifically in urban areas? Where did we carry the most work out from?
The study was done across the country. We had respondents from all of the districts and all of the ethnic groups for Belize. Yeah.
And I think, and based on what Cynthia just said, it seems like there may have been differences reflected based on people's communities, whether rural or urban, and when we break down the numbers into greater detail, are you also seeing those slight variances among different communities and other different factors?
There were slight variances, yes. However, what we note is that the perceptions around violence and around how to access services were the same across all of the communities, whether it was urban or rural. Slight changes, but nothing to significantly say that there was a challenge with accessing service. I think if we look at the results, it showed that although only 11% felt that a man was justified in beating his partner, if we look at those who would access services, 56% of women said they would inform the police, which is almost less than 0.5% of those who felt that it was not justifiable for a man to beat his partner. And reporting to the police was the highest number, the highest incident that persons felt the best place to report. So it shows that there is an issue in terms of the confidence in the system and how people report, because we have to look at the other almost 40%. Where are they reporting? Who are they seeking support from? If not the police, if not the health services, the social workers, who are they? How are they getting support? So I think that is one of the eye-opener for these findings as well.
And that's interesting, because one of the areas that the study looked at was also addressing or looking at evaluating some of our existing policy and legislation to account for perhaps why we're seeing some of these figures. And can you talk about some of your findings in relation to the domestic policy as it relates to violence against women and girls?
Cynthia, would you want to take this one?
Cynthia.
Sure. I think one of the things as it relates to, just the institutional framework overall is the fact that, through the baseline, there was no real identification of one national coordinating mechanism that really addresses at the issue of family violence, right? The project itself looks at the issue of family violence. Within it, of course, you have to look at the issue of violence against women and girls specifically. So in there, it tells us something, because we have to relook even now as we have drafted the national gender policy and a newer national gender-based violence action plan, we have to consider the fact that these findings are telling us that there is a need for a national coordinating entity. While the National Women's Commission is the designated national coordinating entity, there seems to be that lack of awareness in the general public. And in terms of how we look at the data, it also has to do with the fact that when we look at how do we address the problems, you cannot do it only at one level, like I mentioned before. And the national coordinating mechanism will have a different responsibility, not implementing direct services to individuals, but looking more at the programmatic development and in terms of supporting those entities that do, such as the government ministries, as well as direct services that are offered to these individuals by government entities, but also by civil society. And so the coordinating role is very crucial. But at the same time, the same importance has to be given to the other levels in terms of service provision, in terms of development of programs that directly happen, and how do you make those connections? Because that's what the national entity, the coordinating entity, would need to do to make the necessary connections between the implementers and those who are receiving the services. And so in that sense, we are challenged, because the National Women's Commission, while it's doing a lot of it, the fact that it doesn't have a direct presence in terms of individual spaces, we are supported by the district committees in the districts. But again, those are individuals that are designated by different government entities. So we have to be able to really sit down and look at how can we use these findings and strengthen the system or strengthen the response in what we have been doing, because it is saying that while we have been doing quite a lot, there has to be a lot more work done in terms of changing the attitudes. While we do say it's only 11.2% of the person, in my mind, it's still a great majority. And we do have to also understand that, in terms of how often do we conduct these baseline studies is important as well. This is the first one for Belize, and we're happy to have it done. But even in terms of establishing a prevalence, that hasn't been done. So both a baseline and a prevalence would be able to give us much more information on how to be able to take this data and use it to strengthen the response that we currently have. So definitely for us, it is looking at the fact that even nationally, we don't have a one institution that is responsible to fully collect data as it relates to the issues of family violence. As well, we have the multiple entities that collect their individual data. In the past, we used to have a very strong national gender-based violence surveillance system. That was one of the first in the region. And so we have to be able to look at how do we also strengthen that, because the baseline is the first step in collecting evidence, in structured evidence, to ensure that this is something that identifies what are the gaps. And although we know some of this information, doing it, utilizing this methodology kind of gives us a bit more foundation in terms of what we're seeing and what we're doing in the community. So definitely, I think for us at the institutional level and at the policy level, it gives space for other recommendations to be made to government in terms of some mechanisms that need to be strengthened and other actions that need to be implemented, particularly looking at the data and the coordination aspect of all the work that is currently happening, because civil government are doing quite a lot, but somehow we're kind of missing those synergies still yet. And how do we integrate other areas such as the private sector as well, and other missed opportunities that we may have to the work that is being done at the community level?
I want to shed light on the numbers that I'm seeing here, because it is alarming. This is not a fun matter or a fun factor or anything to laugh or smile at. This is very important for folks to understand. And it's the baseline study recognized form of violence. Now in the study, it says the most recognized form of violence was physical abuse at 79.4%. Then there are other recognized forms of abuse, including sexual abuse, which has a number of 48.3%, verbal at 40.7%, emotional abuse at 24.1%, deprivation of liberty 10%, and other forms of violence, which was recognized, well, falls in that about 13.8%. Look, this or the numbers are actually saying that, of course, one of the things, especially in the household, we're doing wrong to our, especially from us men, we're doing wrong to our partners. We're hitting them, we're sexually abusing them, we're verbally abusing them, and these are the things that we need to curb, Cynthia and Malenie. Now, how do we, because we're not doing this study because we just want to put numbers out there in a pink piece of paper. We're putting these numbers out there so folks can be cognizant that these things are happening and we need to stop it now. How can we do that from this study?
Well, the first thing that we have to do is to recognize, and this is what we're doing now, to shed light on this situation. We know that culture plays a big role in how we socialize the whole issue of gender-based violence. And so I think the baseline study now provides a platform to speak about gender-based violence in a broader platform, as well as to incorporate issues of culture and how we can address these issues to curb or to reduce and eliminate violence against women and girls in the home. And then we have to look at the interventions that we're doing. As Cynthia mentioned, we're doing a lot of things, but if it's not really trickling down or the understanding of the communities, of the persons that we're targeting is not clear, then we have to pull back and do an assessment of what we're doing and see how we can do it better. And I think that's what the baseline study provides for us, an opportunity to do better. And a colleague of mine always say, if you know better, you do better.
Of course.
And this is opportunity for us to do better because now we know the numbers are clear. It's not anecdotal anymore. These are data that we've invested in collecting, and now we can develop interventions that address these gaps. And then we have to take into consideration how we engage men and boys in the fight against ending violence against women and girls, and not just as perpetrators, but as champions, as supporters, as advocates for women and girls and gender equality. And then we have to ensure that what is in the legislation is understood by the communities. And I think that's one of the challenges that we've found, even with the baseline study, but even in implementing interventions, is that although the legislations are there, people don't really understand what it means because the language is not clear enough for them to understand. They don't know the kinds of protection that is offered within the laws, and even sometimes the service providers who they are going to access support don't even understand the legislation. So we have to also look at how we unpack legislation that the persons tasked with providing support to survivors can do that in the best possible way, and that survivors also know how and where to access services. And critical is that what types of services and support, especially protection mechanisms, that are available to them.
Indeed, because and I like that you said that, because another part of this study is actually which states laws and policies. In the year 2019, 217 cases of domestic violence were reported, but only 1.4% of these cases were taken to court, and then 1% of those cases resulted in convictions of perpetrators. Why do you think this is?
We have to definitely look at. I think at the end of the day, a lot of these cases, a lot of these situations happen within families, and that's the importance of looking at it from a family perspective. As you know, the Ministry of Human Development looks at the family in general, even though the work may be done differently from three different departments. But for a very long time, we have been saying, and it's a common knowledge if you're unable to really support the families and support the needs, the gap, the challenges that these families face, you will have definitely other issues that will affect not only the family, but communities and society in general. So one of the issues when we look at the issue of families, like what Malenie was saying, the aspect of culture and how we've been socialized, and that creates issues. When we look at the issues that men and boys face, it all stems out again to what are the messages, what are the things that we're saying in terms of how we all should be behaving. While we accept that in the past or generations ago, those type of ways of handling or behaving would have worked because that was at what the point where we were then. We also have to be able to consider that our society has moved. No longer is it really feasible for many or majority of the families for the mom or someone to remain in the home, and for another one to the cost of living has risen greatly, not only in Belize but around the world. When you look at the issue of COVID and the impact that it has had in terms of communication within families, the issues of mental health that continue to really hinder the way that children, adolescents, men and boys, and even women are able to deal with the related stresses that has been brought through COVID. It tells us that if we don't invest in families and be able to address the underlying values, attitudes, and norms that families have, we will continue to have these issues. And so for us, I think it's important to be able to help be able to both men and women recognize that while we all have a role to play, and often those roles may not be the same as we have been used to. But at the end of the day, we have to also understand that we need to be able to ensure that at the end of the day, the rights of each individual is also upheld. And when violence is in play, when violence or values that hinder the opportunities for individuals within communities to be able to access jobs, to access health, to access protective mechanism, then we're not doing what we're supposed to do, whether this is coming from civil society within families, but even within government. And so that is what I think some of the data that has been found within the baseline study can help us to be able to bring those numbers don't lie. And that's one of the things that I like about numbers, even though I don't like numbers, because sometimes they kind of change to really lose the humanity aspect or the face of the stories behind it. In this instance, definitely something that is good, because you can now merge what we have been told anecdotally to numbers, that is the reality that people are facing, and that there's so much more that needs to be done.
And
if I can just add to what Cynthia was saying, in addition to those aspects, we also have to take a look at the services that are provided for women, especially, and their families when they're leaving or need to leave these violent situations. That a lot of these support services, the shelters and these mechanisms are only short term. And so the challenge that these persons are faced with is, if I leave and after a certain period of time, then I have to find someplace else, what do I do? And that also influences how they proceed with these kinds of reports. When they report the violence and they go through the system, the fear of what happens next, as well as the challenge of being unaccompanied because of their economic situations. They're not able to access legal support to the extent that they can go through this system with. So those are also some challenges that affect those numbers as well.
And I think, just if you let me also, I think one very important factor that also affects why those cases don't reach is the fact that in many spaces, legislation hasn't met with the reality of people nowadays. When you look at a situation where a woman is applying for maintenance, for example, that would be a source of income, while she also has a direct responsibility to also provide for her children. The partner, maybe from she's seeking separation because of violence, if she doesn't have a bank account, if she doesn't have a social security card, those are impediments for her to be able to access these services, because then even if she goes through the court system, she will not be able to get those funds to an account for her children. So there are quite a lot of areas where the legislation hasn't really met the reality of the people that we're meeting and we're working with. And again, those are some of the things that are being looked at currently in terms of what are the legislation that need to be reviewed. How can this be strengthened? Because we have to consider the reality of people. It might be easy for some to say, well, you know what, I'm going to go and separate or file for a protection order and I'm going to claim maintenance. But the fact is, majority of those in the communities, they don't have those type of privileges. And I think those who have need to be able to examine those privileges and be able to say, well, what can be done to ensure that those who don't have and be able to advocate at the same time. Because the advocacy needs to come not only from those who are doing the work, they also must be coming from the private sector. It must come from persons in the community or other organizations that might not necessarily be doing work in the area, but their voices need to be also added to the lobbying and the advocacy that needs to be done.
Absolutely, and that was actually going to be part of my next question, which is really the use of this data, or will this data be shared with the stakeholders so that we can eventually see the type of change so that we can improve. And I mean, based on the study that was done, I mean, stakeholders include, you know, the responders to issues of domestic violence, the police department, perhaps medical professionals, and even people who may be witnessing family violence, teachers. So is there a coordinated, or is there any plan for coordination with stakeholders to perhaps change or implement some policy changes?
Yes, so we've already, under the Spotlight Initiative, been addressing policy, legislation, and institutional strengthening gaps. So the baseline study now provides a greater platform to advance some of these interventions that have started. On Monday this week, we had a launch of the baseline study where it was officially launched to these particular stakeholders that you're talking about. The government and civil society actors, as well as those persons who support the response to ending violence against women and girls. And as the Spotlight Initiative, we will continue to socialize these data. We will continue to meet with stakeholders. We will continue to look at how we can unpack the data and develop interventions that address the gaps that exist in the data. One critical action that is currently on the way as well is the behavior change communication strategy that is also building on the baseline study and the gaps that were identified, particularly around prevention and service delivery, to ensure that civil society and government are participating in how we communicate. And that's one of the, I know Cynthia mentioned it, almost 90%, a little over 90% of the persons that were a part of it were not aware of community interventions. So we also have to look at how we are communicating or how we are talking about the interventions we do in the community so that they know that these are interventions that are addressing issues of violence in the home or violence against women and girls. And so all of these things are actions that have started, but now can be strengthened because of the data. As Cynthia mentioned, data doesn't lie. So this is the hard facts that supports the direction we've been going in.
Indeed. You know, I always say that a buy-in process is always a great route to success. We have been advocating for, we've been talking about domestic violence for years upon years, Cynthia. But at the same time, let's talk about what has it been like, especially for or refer to them as Gen Z and the younger ones that's coming up. Now, I'm saying this because we know how things were back in the day. We do know that, especially when it comes to culturally, when it comes to in the rural areas, and how things or how people are impacted, especially in the urban areas. But what about our younger ones? What are they saying? Have we been studying these folks to see what kind of fruits we're actually bearing from the younger ones with respect to try to disregard domestic violence?
In terms of young people, I think for the National Women's Commission, we've been conducting girls' roundtables across the country. We've had in Orange, we've had in Rosal, in San Pedro, Belize City as well, and it's really also eye-opening, but it's also very, for us when we hear them discuss that they are also experiencing a lot of these types of violence. And while they're very much aware of what violence is and what are the things that they should do in some spaces, what I think for us was the concern, especially, is the fact that they are experiencing a lot of street sexual harassment. And in many spaces, they feel unable to really do anything because, one, there's no legislation that addresses that. And the other one that ties in a little bit to some of the data that is shown in terms of the people who don't want to make reports, or to who that they should be making reports, is the fact that some of these harassment are even coming from uniformed persons in the communities, even when they go to the store, when they go into the school in their uniform, and some of the young girls particularly, because we're having pretty young girls, and we're hoping to be able to also extend it and have much more of a co-ed discussion between both. But they are aware, they're a bit more independent in terms of the things that they want. They're aware of what are the things that are going on in their communities. So it's important for us to be able to ensure that when they are accessing those services, then we have them ready for them. And right now, I don't think we are ready for them. But I think in terms of the young, we still need much more information. I think that is one of the areas that we're hopefully going to be able to do through the behavior change campaign, to be able to address the strategies, the different programs, to their level, to the way that they see things, the way that they understand things. Because, I mean, like you said, we know what have been going on from the past. Sometimes it's, how do you ensure that you get it to them and the message they're getting? Because sometimes I don't think we're doing it correctly, honestly. And it's not because we don't want to, and it's just simply because maybe we haven't taken the time out to really develop. Like I said in one of my comments, the investment is really important. Yes. Because you need to be able to have very specialized ways of doing these things and addressing and being able to target the various groups. Yeah. And that's why it becomes much more complicated, because then you have to be doing a lot of services, specializing in so many ways to be able to get the information to the groups that you're targeting. When you talk about even issues of the elderly, they also are facing quite a lot of abuse within their homes as well. But even some older women speak about domestic violence at the age of 60, 70 years old. Yeah. So that is not something that the type of violence that they only experience between a specific age range. These can go up to very old. So we have to be able to invest in different types of programs and interventions that are very key and get to the root. And again, considering how we do it, because we have different target populations. And I think one of the challenges as well in terms of some of the work and how it's implemented is the fact that a lot of these frontline persons, especially when we look at police, when we look at health, because we were concerned the fact that only 1% of persons really would be willing or feel comfortable in making reports to health personnel, is the fact that there's a lot of transfer within these type of settings. And I think one of the things that we need to start thinking and considering is the fact that when it comes to certain areas, there has to be specialized services with people having that type of training and education, where yes, you might have the opportunity to go up in terms of your career, but within those sectors, we don't really have that right now. And so it really limits the information, because while we have been doing training, it kind of explains why we still have to be doing training continuously, because there's movement within these type of professions that honestly are really needed and key. And so we have to be able to work at the underlying norms and attitudes. And that doesn't take 1 year. That doesn't take 2. It is a process that evolves over time. Even for many of the persons that have been working in the sector, it's something that you have to be continuously doing and being aware of how you yourself are perpetuating these negative and toxic values and attitudes, and be able to stop and change how you do things. So we hope that the behavior change campaign helps us to be able to do that and be able to then how to be able to get investment, because it's definitely these type of practices that deal with the humanity, with issues of people that require quite a lot investment.
Now, I know that time is just flying by just like that, but finally from us, let's quickly discuss why this report matters for Belizeans and where it can be found.
Okay, so this report is important because, like we've been saying throughout the discussion, it really provides a picture, a true picture with numbers about where we are in terms of the issue of violence against women and girls, and particularly focusing within the home. And so we want to ensure that everyone, the decision makers as well as communities, have access to this information and can use it to develop and design interventions that addresses the gaps and provide the necessary support to survivors, women and girls in particular. The baseline study reports are available on the UN website. It is UN Belize, belize.un.org. And under resources, you can have access to the baseline study report there. And in terms of civil society, we want to encourage you especially to take a look at the report and to join in with us in strengthening the support mechanism to the government to ensure that communities, especially those hard to reach, have access to support and services.
All right. Cynthia, any final words from you?
Yeah, I think in terms of the importance of the report right now for us, it also has to do with providing support for the approval and the validation of the recently developed National Gender Policy and the National Gender-Based Violence Action Plan, because it provides the data to say that the things that are being included is what is needed as we continue to implement and to respond to the issues of gender inequality overall. So it really provides, more support for policy decisions and recommendations that we may have to make to government. It provides also support for the fact that coordination has to be strengthened. It is a two-way road. It is not only about coordinating, but also bringing stakeholders and being part of that process as well. In terms of the study, we will also be sharing it on our website, nwcbelize.org. People can access it there. And definitely, I think I usually always like to also include the support that is needed from private sectors, from media stations, because if you notice, there's a very nice video that was developed for Spotlight that gives some of the most key elements, not all, but some. And I think it's important to have those type of videos shared around the country through the media, so there's spots that the media can put it on, advertising it as well, providing that information. We do it through our social media pages as well, but it's always important because we may not reach everyone. So imagine if everyone would share this in their social media page, if media stations allow some time and space to also provide it free of cost, of course, in support of the work, how much more people will be able to get that information. And that has always been our call in terms of the National Women's Commission. Everyone plays a role, and it ties into our theme for these days of 16 days of activism, which is me and you from 16 days to 365, and violence against women now. And so what better way to do that is by including everyone in the work.
Well said. Cynthia Williams and Malenie Barnes, thank you so very much for joining us this morning. Well said, and we're so grateful that you could have joined us. Thank you.
Thank you as well.
Thank you, Gavin.
All right. We're about to take a break. When we come back, though, the third annual Apple for Kids fundraiser. Gavin, I'm looking forward to that conversation. We'll talk about that when we come back.